Hey everybody, this is Dr. Chris Kelsch from Avondale Health Center in Avondale, Arizona. And today I want to talk briefly about plantar fasciitis. Plantar fasciitis is a type of foot pain. In fact, it's the most common type of foot pain. And it's the most common type of foot pain that we see in our clinic here. This information is from WebMD. I encourage you to go to that website. It'll give you some more information. We're going to briefly touch on what plantar fasciitis is, what causes it, and some easy things that you can do at home to treat it. It is more common in middle-aged people. It is something that tends to happen more to athletes and people who are on their feet a lot, like soldiers as well. Okay, so some of the things that can cause it are when your feet are rolled inward too much when you walk. We call that excessive pronation. If you have high arches or flat feet, that can cause it. If you're on your feet a lot, or if you're on hard surfaces a lot, that can cause it. If you're overweight, every pound that you are overweight puts about 5 to 20 pounds of extra stress on the joints of your body. So just do the math with yourself there and see where you're at. If your shoes don't fit or if they're worn out, that'll cause excessive wear on the feet. If you have tight Achilles tendons or calf muscles, that can cause it. If we look at what the plantar fascia is, it's actually a ligament that runs along the bottom of the foot. If it's too tight, it'll pull on the calf muscle back here and the Achilles tendon. But what happens is when you irritate it, you get a lot of pain near the heel back here. So what are some signs and symptoms of plantar fasciitis? So typically, if you've been sitting for a while and then you get up and you have intense heel pain, that can be a sign and symptom of it. All right. But if you are having other symptoms like foot pain at night, there could be other things that are going on, such as arthritis or nerve problems such as tarsal tunnel syndrome. So how is it diagnosed? Well, the biggest thing that we do in our clinic to help diagnose it, or one of the biggest things, is we take an x-ray of the area. An x-ray will help determine, it'll help rule out actually more what's going on. It'll tell us if there's arthritis. It'll tell us if you have a heel spur. But one of the things that's most beneficial to us is we do a diagnostic ultrasound in our clinic. Diagnostic ultrasound will actually show the tissue. It'll actually show the fascia. It'll actually show where the inflammation is at and give us a definitive diagnosis. So that is invaluable. We do that here. That allows us to get a proper diagnosis, which allows us to get proper treatment. So that goes into the next thing. How is it treated? Well, if you need to, you do need to give your feet a rest. If you're on your feet a lot, give yourself a rest. You do need to reduce pain and swelling, so try some ice. Ice every hour for 20 minutes can be helpful. If you take a water bottle, freeze the water, and roll your foot over it, that is effective. That actually provides ice and helps break up the tissue. Also, if pain relievers work for you, like Advil, ibuprofen, Motrin, naproxen, etc., go ahead and try those if those work for you. There's different stretches that are going to work. We're going to go into those in a moment. All right. Orthotics can be very helpful. Orthotics are expensive and they may not work for you. So my advice is to go get some Dr. Scholl's inserts. They're about $10, $20 a piece, and those will give you an idea. If they work for you, then that'll give you an idea if more expensive orthotic will work better for you down the road. So the exercises that we're going to get into right now, I have it right here. So the first one is this the toe flexor stretch with a towel. So what you're going to do is you're going to take a towel, you're going to loop it right underneath the foot there. All right. You are going to basically pull the towel up. That's going to stretch the tissue on the bottom. Okay. You're going to keep the ball of your foot right on the floor. Perform one set, 4 repetitions twice a day. You're going to hold for about 15 seconds. The next one is active range of motion, toe intrinsic. You're going to sit on the floor, okay, with your legs out. What you're going to do then is you're going to bring your foot up, and the toes are going to go down. So you're going to have like an opposite motion. And then you're going to bend your foot down while the toes come up. You're going to repeat that 3 sets of 20 repetitions once a day. Rest about a minute in between each set, and perform one repetition every 4 seconds. You're going to take your time while doing it. So here's what we're going to do. We're going to actually show a couple videos of these being done so you can see them in action. If you are suspecting that you have plantar fasciitis, if you think this is a problem that may be bothering you, we have a coupon at the end of this for a free consultation. This free consultation, we will get some more information, possibly take x-rays of your foot, And we also provide a 20-minute free hydrotherapy massage along with coming into our practice. So feel free to visit our website, and we will go from there. Thanks for watching.